I'm all about natural childbirth. There are so many benefits to you, to your baby, but what if a C-section is medically necessary? Well, sorry, you're out of luck. I'm just kidding. In this video, I'm going to share how you can naturalize your cesarean birth to minimize side effects and mimic the benefits of a normal delivery. But first, my name is Maria. I'm a doula, a Lamaze-Certified Childbirth Educator, and owner of the Primal Pregnancy App, an evidence-based resource for holistic-minded women who want a healthy pregnancy and an empowering birth. Okay, the first way you can naturalize your C-section and minimize side effects to your baby is by going into labor naturally. Even if you know you have to have a C-section, still let your body go into labor on its own. This is important for your baby because in the days, even hours before labor starts, your baby's brain and lungs go through rapid development to prepare them for the outside world. This will help them breathe better, bond better, nurse better. So if you plan the C-section too early, then your baby skips this last developmental stage. So those last few days of pregnancy are super important for your baby's transition into the world. And they're also super important to your transition as a mother. Your oxytocin receptors increase as well, which helps you recover postpartum, breastfeed more easily, and form that strong primal bond with your baby. So do not deprive yourself or your child of these benefits. Go into labor on your own. Obviously, there are some situations where the benefits of an early delivery outweigh the costs, such as preeclampsia, hypertension, etc. So use your own best judgment, and if you do have a medical reason to kickstart labor early, go ahead and watch this video right here to learn how to do so naturally. After labor's already started, contractions are coming, let yourself labor for as long as possible without any medication. This is going to protect your baby's brain and help with bonding and breastfeeding. This is all due to beta endorphins. When you have a contraction, it's actually super dangerous to your baby. It temporarily squeezes the fetus and deprives them of oxygen. This leads to cerebral palsy, learning difficulties, developmental disorders. I mean, it's really scary. Fortunately, your brilliant body sends beta endorphins to protect the fetal brain and keep your baby safe during each contraction. Unfortunately, labor drugs such as the epidural and Pitocin water down these beta endorphins, which then makes your baby more likely to go into distress and require a NICU stay. The downside for you, mama, is that when beta endorphins are watered down, you may struggle with attachment, breastfeeding, and mental health for weeks or longer. So try to avoid any drugs for as long as you possibly can. Now, if your birth calls for a C-section, it's a major surgery, so you will at some point need medication, but the longer you can hold off, the more beta endorphins you and your baby will have to minimize the side effects. And speaking of minimizing things, ask for as little medication as possible during the operation. You want enough so that you don't feel anything, but not so much that you're loopy and you can't be immediately present for your baby. Doctors will often give women more anesthetics than they need to calm them down, but this only increases side effects and detracts from those precious first moments of meeting your little one. So ask for just enough anesthesia to get the job done. Something you should also do before the surgery is a little bit weird, but it will greatly impact your child's lifelong health, and that is vaginal seeding. Let me explain. When a baby passes through the birth canal, she picks up her mother's beneficial bacteria, and this helps her establish the child's gut microbiome. Unfortunately, C-section babies don't go through that exit, so they don't get mom's good bacteria, and they are more likely to suffer from asthma, allergies, and autoimmune disorders. So the workaround is vaginal seeding. This is when you place a cloth or piece of gauze up inside the vaginal canal during labor. After the surgery is over, you rub the cloth all over the baby's mouth, ears, eyes, hands, everywhere to mimic the immunological benefits of a normal birth. Again, I know it sounds weird, but a 2016 study showed that at a month postpartum, C-section babies who had undergone vaginal seeding had similar microbiomes to those born vaginally. Obviously, if you tested positive for any diseases or infections that could pass to your baby, then don't do this. But the moms who watch my videos are highly intelligent. Seriously, I'm so impressed with you all. So I trust you to use your best judgment and be smart with this information. When they get you into the OR, they're gonna put all sorts of cords and wires on you, and that's fine, except that depending on where they're placed, they may interfere with immediate skin to skin, which we'll get to. So ask that any and all wires, monitors, cords are not placed on your chest, because that's where your baby is gonna go. Something else that I recommend is refusing the arm straps. They place straps to constrain your arms because women are typically awake during the surgery. And I mean, the staff doesn't know if you're a crazy person who will reach down during the operation. Personally, I have thoughts on this being kind of demeaning, but my feelings aside, on a practical level, you can't immediately hold your baby when your arms are tied down. So refuse the arm straps to get immediate skin to skin, which then also improves your baby's microbiome and lessens trauma to both you and your child. A C-section is terrifying for your baby, but if they immediately go to your chest, this will help minimize trauma for you both. The next thing you'll need for a naturalized cesarean is a low inverse incision. This type of cut heals better, it results in less bleeding, and has the lowest risk of uterine rupture in future pregnancies. So put it on your birth plan and have dad or doula remind them that you want the incision to be low and transverse. Once the baby's out, have them go immediately skin to skin on your chest. Barring a life-threatening emergency, there is absolutely no reason why a cesarean would necessitate that you and your baby miss out on the life-changing benefits of immediate contact. If for whatever reason you can't provide skin to skin, no sweat, have dad do it. A 2021 study compared C-section babies who got standard care to C-section babies who got skin to skin with dad, and the babies who went to dad exhibited significantly less crying and more stable physiological patterns such as heart rate and temperature regulation. When mom can't be there, dad's presence reduces infant distress and lessens the likelihood of trauma to your child. One more thing, and you'll probably have to fight them on this: delayed cord clamping. It is imperative that you wait a minimum of 3 to 5 minutes, or in an ideal world, you wait until the cord turns white and stops pulsing. There's no need to rush the clamping of the cord. The cord still contains about 30 to 50% of your baby's blood volume after birth. So when you delay the clamp, you allow all of the blood to transfer into your baby's body where it belongs. Just take a look at these photos taken minutes apart. The left shows the baby right after birth. He's lean and pale, and notice that the cord is blue, indicating active blood flow. Just a minute later on the right, the baby is fuller, he's pink and healthier with a white cord, indicating that the blood has fully transferred into the baby. Unfortunately, many hospitals clamp the cord too early, which deprives babies of up to 30 to 50% of their blood volume. This loss can lead to serious issues such as breathing difficulties, which is quite common for C-section babies, breastfeeding challenges, low iron levels, and for preterm infants, reduced survival rates. I like to tell people, imagine if you lost 30 to 50% of your blood volume as an adult. It would be terrifying, and hospitals are routinely doing this to newborns. So to reduce any and all side effects to your baby, insist that the cord remains untouched for at least 3 to 5 minutes post-birth. And if the baby requires immediate medical attention, fine. They can do it right there at the operating table while the cord is still intact. Is it inconvenient for them? Yes, it is. But when it comes to your baby's health and well-being, they can suck it up. And besides, any health crisis your child might face will only be improved by having their full blood supply. Okay, that's everything you can do to naturalize a cesarean birth. As for postpartum, I highly recommend that you watch this video right here to see how you can eliminate any post-birth trauma so you and your child can breastfeed, bond, and move forward just as nature intended. I hope you liked this video. If you did, you are gonna love my other stuff, so hit subscribe to get the evidence-based tips you need to have the kind of birth you want, and I will see you next time.